Hello everyone, I am Dr. Sandip Pal. I am a consultant gastroenterologist and hepatologist. So today the date has been declared as the first World Nash Day. So today on occasion of this day we will discuss a bit about the fatty liver disease. So what is fatty liver disease? Fatty liver disease is a very common condition that we find nowadays. So that is simply it's the deposition of fat in the liver is known as fatty liver. So all fatty livers are not harmful. So fatty liver disease, only a certain portion of the fatty liver patients, only a very small percentage of fatty liver patients, they progress to cirrhosis of liver. So if you ask me what is the prevalence of fatty liver disease, it's around in India, Indian studies have shown around 30% of the population suffers from fatty liver disease, but out of that 30%, only 2 to 3% of the patients they progress to cirrhosis of liver, can progress to cirrhosis of liver and can also develop hepatocellular carcinoma. So which population who are at risk of fatty liver disease? So the risk population for developing fatty liver disease is the diabetic patients, the patients who are obese, patients who have insulin resistance, patients who are sedentary lifestyle, patients who lead a sedentary lifestyle, patients who have cholesterol, high cholesterol level in the blood, and less exercise, who doesn't do much exercise. These patients are at risk of developing fatty liver disease. So what are the consequences of fatty liver disease if not taken care? So that already I have discussed. If fatty liver is not taken care, this can progress to cirrhosis of liver, and this can also progress to malignancy, cancer of the liver. And percentage already I have told, it is only 2 to 3% of the patients who develop cirrhosis of liver, and out of that again a very small portion may develop hepatocellular carcinoma. But because such a large population is affected with fatty liver, even this 2 to 3% comes on to become a very huge number of patients. And in the West nowadays, fatty liver disease is the most common cause of cirrhosis, and also hepatocellular carcinoma. It's going to soon, fatty liver disease will become the most common cause of hepatocellular carcinoma. So next, whom should the patient consult? Whom should the patient consult if you develop fatty liver? You should visit. You can visit a general physician, you can visit a hepatologist, or you can visit a gastroenterologist if you have a fatty liver disease. So if one has fatty liver disease, what are the treatments should be done to control fatty liver disease? So see, there are so many drugs which have come for the treatment of fatty liver disease, but the most common intervention for fatty liver disease is lifestyle change. So the most common treatment modality for fatty liver disease is physical exercise. If someone is obese, they have to lose weight. Treatment of diabetes, treatment of cholesterol, high cholesterol values. So this lifestyle management has to be done, and the most important risk factor, that is obesity, has to be reduced. The most important intervention is reduction of weight, body weight, physical exercise, regular physical exercise. And there are few medicines which we prescribe, which we doctors prescribe if there is fatty liver, along with if there is LFT derangement. Only ultrasonography showing fatty liver disease medicines are not required. If along with fatty liver disease, LFT, liver function test, also shows increase SGOT, increase SGPT, then there are some pharmacological interventions which can be done, some medicines which can be given. So another last point I would like to discuss is not all obese patients develop fatty liver disease. There is also a type called lean type Nash. So this is the Nash is the name of the disease when they develop cirrhosis. So even the lean and thin individuals can develop fatty liver disease, and that is usually genetically predetermined, and for that we have to do genetic studies. But usually the management again remains the same. It has to be physical exercise, weight reduction, and lifestyle management. Thank you.